For more than 2 years, we've been talking about mixed messages, and we're learning terminology as far as COVID, pandemics, endemics, and well, COVID-19 cases are once again on the rise in Colorado as well as around the country. So our 9 Health expert, Dr. Payal Kohli, is back with us today. Talk more about what we can do. Now, we keep hearing that the COVID-19 has become an endemic, yet cases are going up. So where do we stand as far as using that term, endemic, with COVID-19?
You know, very interesting. So in order to become endemic, you really have to have a few characteristics. 1, you have to be constantly present. 2, you have to be indefinitely present. And 3, you have to be at a predictable level. So COVID-19, where we're at now, we're just in that transition phase where we're constantly present. We're probably indefinitely present because we've realized that the immunity is not going to last forever, but there's not a predictable level. So like with the flu, for example, it goes down and it goes back up. So cases can go up and down, but it has to be predictable. And I'm not sure we're there yet, especially with the summer coming and more travel, new variants.
The gray area, and also people getting bored with it.
That's right. And it can very quickly go right back to the epidemic phase. And that's what we have to realize. This is not static, but we can easily transition from one to the other based on our behavior.
We want it to be like a season, because flu has a season, but just to help us that way. But now, so many of us are boosted. Many of us have been vaccinated fully. Some have already had it, even like breakthrough cases. Should we all still be worried?
You know, the problem with this is, yes, because the immunity goes away and we're getting new variants. Okay. So it's not like the measles. Once you get it, you're immune for life. It's like the common cold. You can get it over and over again.
And over and over. Ugh.
And what we're learning with Omicron is that the rate of reinfection, if you've had a prior variant, is 3-fold as high. Now, Tom here has had it, so he may be asking, how long does this immunity last? It can be anywhere from 3 months to 5 years. And it's highly variable from person to person, and highly variable.
So you don't know.
I also want impunity. I'd like both if I could.
You
get
would,
them both.
wouldn't you?
so the thing is, we know the vaccine is incredibly helpful, not perfect. We also know that testing is incredibly helpful and not perfect. Now, our own producer working with us today, Megan, she had symptoms, tested negative on a rapid test, thought she was negative. She ended up being positive. That's somewhat common. What do we learn about that? What does it say about testing and how effective it is and how aggressive we need to be about doing so?
This is so common. I've heard the story over and over again.
Really?
Especially people that are vaccinated. Because before we were vaccinated, the first sign of symptoms means you have a lot of virus around, because that virus is causing the symptoms. Now that we're vaccinated, the immune system gets tickled, very little virus around, but the immune system is causing the symptoms. You take that rapid test and falsely believe that you're negative, just like Megan did, but you really should have followed that with the PCR test. So if you have symptoms, 100% of the time, you need to follow your rapid test with the PCR test.
Even if your rapid test is positive?
If it's positive, you can hang your hat
Presume
on.
that's
Oh, then you say, I'm out for a few days. That's the deal.
But if you get a negative and you're symptomatic,
follow with PCR and really isolate yourself until that PCR comes back, because it's probably just early in your infection.
Also, just want to let people know that Megan's back with us here at work. She's
yes,
fine.
She's
went
fine.
Through she did her little time, and now she's back with us. So we're glad to have her back. We're always glad to have you back as well, Dr. Payal Kohli. Thanks. We'll be right back.